How do we transport TB sputum samples from remote areas? Transporting tuberculosis sputum samples from remote locations is a vital part of diagnosing and controlling the disease. It involves careful steps to keep the bacteria alive and prevent any risk of infection. First, the samples are collected in sterile, leak-proof containers made specifically for sputum. These containers are clearly labeled with patient details and accompanied by a request form. To protect the sample during transit, they are placed in a triple packaging system. The first layer is the primary container holding the sputum, then a leak-proof biohazard bag with absorbent material, and finally an outer rigid box or transport container that prevents physical damage and contamination. Once collected, the samples need to be stored properly before they are transported. The best practice is to refrigerate them at temperatures between 2 and 8 degrees Celsius. This helps slow down any bacterial growth and keeps the sample in good condition. If immediate transport isn't possible, refrigeration can be maintained for up to a week, but ideally, samples should reach the laboratory within 24 to 72 hours. Some studies suggest that, in very remote areas, samples can be stored without preservatives and transported without refrigeration for longer periods, but refrigeration remains the safest way to preserve sample quality. Transport methods vary depending on the location. Ground transportation in cool boxes with ice packs is common, especially for short distances. In areas with difficult terrain or poor roads, drones are increasingly being used to deliver samples quickly and safely. Research shows that drone delivery does not harm the sample quality and can significantly reduce the time it takes to get results. In some cases, samples are shipped via postal or courier services, but strict packaging and temperature controls are essential to meet safety standards. Because tuberculosis samples are infectious, they are classified as Category B infectious substances. This means they must be transported following strict national and international regulations. Transport personnel need special training in handling infectious materials, and containers must be clearly marked with biohazard labels. Communication is also key. Laboratories should be notified in advance of shipments to prepare for processing. Proper documentation, including patient details, collection, and receipt records, ensures traceability and accountability throughout the process. In challenging settings with limited refrigeration or difficult access, innovative solutions are being explored. These include refrigerant-free storage options or the use of solid culture media that don't require cold temperatures. Advances in drone technology and other logistics solutions are helping to overcome geographic barriers and speed up diagnosis times. Overall, transporting TB sputum samples from remote areas requires meticulous planning, proper packaging, maintaining the cold chain when possible, and following safety regulations. These measures help ensure the samples remain as valuable, leading to accurate diagnosis and better treatment outcomes, even in the most difficult environments. Always remember, for specific cases, consulting healthcare professionals and following local health guidelines is essential.